Okay, my name is Taylor. Amirah is not here, but she will be sharing her slides here with the video on the bottom. We decided to do our presentation on infrared therapy. So what is it? It's a type of electromagnetic radiation. It's got wavelengths that range between 760 nanometers to 100,000 nanometers between microwave and visible light. So you can see here, it kind of hangs out here right above visible light, with generally like in the middle in terms of like the wavelength and the frequency compared to many of the other lights that we have in the universe. It's derived from thermal energy. So essentially any material that emits heat can produce it. Higher temperatures will lead to higher frequencies and shorter wavelengths, so more so closer to this side. And the concept is that different wavelengths can penetrate the body at different depths depending on the skin, the thickness of the skin, the pigmentation, the vasculature that's there. And that shorter wavelengths can penetrate deeper, up to 4 centimeters. So how does it work? It induces membrane potential alterations, and in doing so, the infrared radiation can induce DNA destruction, leading to ROS formation that leads to an increased intracellular calcium release, and a responsive rise in nitric oxide within the tissue. This stimulates growth factor production and extracellular matrix deposition that promotes tissue repair. And ultimately, this produces improved blood circulation from the nitric oxide release that can promote wound healing. It can decrease muscle spasms, improve sensory nerve conduction velocity, and contribute to pain control via the modulation of endorphin release.
So these are types of infrared therapy. There are 3 main types, and they're differentiated by wavelengths. So going from deep to superficial, we have far infrared, which is also known as non-luminous, that can penetrate muscle, joints, and bone. And then you have mid-infrared, which can penetrate soft tissue. And then lastly, you have near-infrared, which is also known as luminous, that penetrates the dermis. And this form actually uses non-ionizing forms of light sources. So, for example, lasers, LEDs, and...
We're pausing really quick.
So these 4 types of infrared therapy, there are 3 main types, and they're differentiated by wavelengths. So going from deep to superficial, you have far infrared, which is also known as non-luminous, that can penetrate muscle, joints, and bone. And then you have mid-infrared, which can penetrate soft tissue. And then lastly, you have near-infrared, which is also known as luminous, that penetrates the dermis. And this form actually uses non-ionizing forms of light sources. So, for example, lasers, LEDs, and
Could you guys hear any of that? I can go over it. Okay. You can hear it? Okay, so essentially what she was saying, she was just kind of explaining the different types of infrared therapy. There's far infrared, that can penetrate into like muscles, joints, and bones. Mid-infrared, which penetrates more so into soft tissue, and then near-infrared, that penetrates just the superficial surface of the dermis. And the near-infrared consists of non-ionizing forms of light sources like lasers and LEDs. And so here are some of the clinical uses. We have musculoskeletal. It's been used in fibromyalgia, chronic pain, sport injuries, dermatology for stretch marks, acne, psoriasis, eczema, wrinkles, hair loss, neurological uses for like neuropathic pain, traumatic brain injuries, and then in oncology, it's been used in cancer, tumors, and hyperthermia. So we're going to start with musculoskeletal uses. It has this topic had so many studies on it, so it was also hard to like figure out what exactly we were going to include. But I wanted to divide things into like chronic pain, the treatments for that, effects on performance, and then effects on recovery. So regarding chronic pain, there was a study that looked at chronic low back pain. They gave infrared therapy around the waist to these patients at 800 nanometers to 1200 nanometer wavelengths. And they used a numerical pain scale and saw that while using the infrared, The pain scale fell from 6.9 to 3 out of 10 in patients with infrared, while the placebo group fell from 7.4 to 6 out of 10. Additionally, in fibromyalgia patients, they placed them in this water-filtered infrared whole-body hyperthermia machine, which is this thing, for 6 weeks, like one time every 6 weeks, and it resulted in a significant reduction in pain intensity by week 4, which continued on to week 30, so significantly after they stopped the treatment in general. Regarding performance, they looked at muscle fatigue and elbow flexion. It was a smaller study, but they found that these patients that were repetitively doing elbow flexion at 75% of the maximum workload until exhaustion ended up, with the infrared therapy, being able to increase the number of reps that they were able to do by 14.5%, and an increase in the amount of elapsed time before exhaustion by 8%. They also found that there was decreased post-exercise creatine kinase activity, lactate level, and CRP, indicating more of a faster recovery in those patients that received the infrared. They also looked at muscle fatigue and knee extension. This was 17 patients doing isokinetic fatigue testing with the LED infrared over their quadriceps. They saw a smaller decrease in the maximal torque after high-intensity concentric isokinetic exercise. And then regarding recovery, they found some anti-inflammatory effects. I thought this was really cool. They developed this infrared-emitting clothing that they gave soccer players after their exercises, after plyometric exercises, sorry. And they would sleep in these clothings like for about 6 hours after their exercise, and it led to a reduction in their perceived delayed onset muscle soreness, DOMS at 48 hours and at 72 hours compared to the placebo. And then a suggested mechanism is that the increased production of nitric oxide resulted in decreased production of free radicals and addressing the inflammatory markers within the body. Dermatology, so a few studies show that it has benefit in healing skin wounds.
Chronic itch.
Yeah, I should have added chronic itch. Okay, so infrared on full thickness skin wounds showed an increase in growth factor in TGF-beta1, and also an increase in fibroblasts for improved wound healing. Additionally, there's a study looking at tissue regeneration with infrared therapy at 950 nanometers. Used directly, it was able to activate fibroblasts and increase collagen and elastin synthesis. And then I thought this was interesting that there were some antimicrobial properties. The incorporation of nanoscale germanium and silicon dioxide particles into nanofibers ended up producing this far infrared radiation that had antimicrobial properties. It reduced Staph aureus and E. coli by 99%, the growth of it by 99.9%, and Klebsiella pneumoniae by 34.8%. So I thought that was really interesting.
So one of the up-and-coming applications of infrared therapy in oncology is near-infrared photoimmunotherapy, and it's a molecular targeted cancer treatment. And essentially the way it works is that a cancer-targeting moiety is conjugated with a dye, specifically IR dye 700, and that moiety binds to and induces an immune response in cancer cells, which kills them. And right now, there's currently a phase 3 clinical trial of this photoimmunotherapy that's underway in people with recurrent head and neck cancer. And in this case, they specifically target the EGFR1 gene. So infrared stimulation in the neurological world is relatively new, but something that's up and coming right now is something called infrared neural stimulation. So there's a study that looked at 5 patients who underwent standard lobectomy for epilepsy. They measured their response to INS with optical imaging, and they found that the responses to INS in the cortex were highly focal and led to suppression of nearby areas. So this could be good for a condition where we want to treat a very specific area of the brain. The other study we looked at therapy is visible. It's between 630 and 700 nanometers, and it's lower penetration. And from what I read, Amin uses for the skin, so anti-aging effects, and hair loss are a couple of examples of what it's mainly used for. And then near-infrared therapy, which is what we've been talking about a lot in our presentation, is invisible, and it's between 700 and 1200 nanometers. Again, these are approximate numbers. A lot of the images you'll see in this presentation may have a little bit of difference in the exact wavelengths, but it's deeper penetration, so it's used for muscle, joints, and soft tissue as well. But a lot of the times these two are